Happy New Year and welcome to the TPG Difference. This series was created to do something different, move beyond surface-level commentary and tackle the real issues shaping employer benefits with candor and creativity. 2025 was a year of transformation. We saw sweeping legislative changes like One Big Beautiful Bill impacting employer-sponsored benefits, relentless upward pressure on health insurance costs, consolidation reshaping the broker landscape, and political uncertainty that kept employers guessing about the future of ACA subsidies. For mid-market employers in the Pacific Northwest, these forces aren't abstract. They're impacting budgets, strategy, and the ability to attract and retain talent. So today, we're tackling 4 meaningful topics that employers should start talking to their brokers about. What they should start doing, what they should stop doing, what trends will emerge, what trends are changing, and what we can expect to remain consistent as we look into 2026. Welcome to the TPG Difference. I'm Sarah Friend, President of the Partners Group. This is our 4th episode, and we are gathered again here, dusting ourselves off a bit from a rough 2025 renewal season. And so we're gathered today really to talk about the future, to talk a little bit about, okay, it's only January, but how do we get ahead of these necessary conversations to really prepare us well and prepare our employers well for 2026 and beyond. So we've picked 4 topics. Well, our panelists have picked a topic each that we think is really meaningful for the next year and we think employers should be considering. But I want to start this conversation and open it with what I think is a pretty meaningful idea or concept, which lots of people have heard about, and it's called the Stockdale paradox. And the Stockdale paradox is basically holding 2 truths at the same time. The first is being willing to accept the brutal facts of your current reality. And we had to face some really brutal facts side by side with our employers this year. I think I've been in this industry for 30 years. Many of you have been in this industry for the same amount of time. And this was the hardest renewal season I can ever remember. And part of the brutal facts is just because the calendar has turned from 2025 to 2026 doesn't mean that that magically goes away. I think we all wish it would, and that was like a blip on the radar, right? But the brutal fact is that our whole system is under pressure that isn't just magically gonna go away. And so facing that reality and really working alongside our employers to say, what do we need to be doing differently going into 2026? What are the things we need to be talking about? What are the things that we need to uncover together? Is something that I think is really critical for people in our roles as brokers and our responsibility to really lead CFOs and HR vice VPs and owners of businesses through these really tough, the brutal facts of our current reality when it comes to employee benefits. But it's not all bad news. That's the beauty of the Stockdale paradox, is that yes, that is one truth to hold. And the other truth you need to hold at the same time is a belief that in the end, we will get through this and we are gonna find a path forward. We may not be able to see exactly what that looks like, but confidence in the long term that we're gonna find a strategy that balances both employer goals as well as their budgets. It's not easy. There is a ton of pressure. Employers are so frustrated. We know that. We sit alongside of them every single day. Employees are feeling the impact in their paychecks when they have their employee deductions taken out, as well as their copays and rising deductibles, confusion, lack of access. Everybody is feeling it. And so we feel the brutal facts, and I think we wouldn't be in this job if we didn't believe that we could, in the end, find strategies that are going to carry employers through this. And so that's our focus for today, is really acknowledging the hard stuff, but also really looking forward to say, okay, let's dust ourselves off a little bit and focus on just a couple things that we think we want to be talking to employers about in 2026. And so here with me is our panelists. And so we've got Zach Fritz, Case Escher, Jane Perlis, and Chad Kemmis. And so each of you have really chosen your own topics for today. And I'm so excited about this conversation. But we're going to start with both what comes first in the alphabet and maybe the obvious one that everybody's talking about. So, Case, you chose AI.
I did.
So let's dive in.
All right.
What do you think we need to be talking about when it comes to AI?
Well, to not pile into the first part of the Stockdale principle you described, throughout the end of this year, I frequently have been asked, "How's it going?" And when I think about how it's going, I think about how it's been. I think about what's going to happen next year. And as I look across the landscape and I look at all the different vendors and employers I work with, I have said this repeatedly. I don't see anything constructive on the horizon. I see wage inflation, I see cost rising, I see morbidity getting worse when it comes to healthcare costs. And so in prepping for this session, I looked deep within my soul and searched my feelings. Yes. And I tried to find something that is constructive and that I think will ultimately counter, maybe not completely, but at least have a mitigating effect to the macro pressures that are happening in healthcare right now. And that topic is AI. If you were to search right now and ask the question, tell me where AI is being used to deliver care. And if you said, tell me where AI is maybe credentialed as a provider or on the path of becoming credentialed as a provider in any state, you would find that nobody's embraced that yet, but you would find that a pilot launched in Utah in late 2025, actually in December, with a firm called Doctronic. And what they are doing, and the state has authorized them, they are basically using AI to prescribe up to 190 chronic medications. It just launched. In fact, the press release just hit yesterday on it in terms of it being searchable. So my prediction really is we've seen nothing yet with respect to how AI is going to impact a lot of things, but specifically care delivery and healthcare, cost in general. And my prediction is by the end of 2026, there will be at least 6 states who are in similar trials, meaning the state authorities, the regulatory authorities have authorized a limited trial on allowing vendors like this to act in this way.
So talk a little bit, yesterday we were talking about the triple aim. So cost, quality, patient satisfaction. So tell me about this specific endeavor. Is this targeted to cost, quality? Like, what is it aiming to do and how does it do it?
Yeah, I mean, it's all of it, really. The triple aim that you just described is at least a decade old, if not more, and it really was born out of healthcare systems, healthcare quality, and then the goal, as you just described, is lower per capita costs, better outcomes, clinical outcomes, and better patient satisfaction. And that's something that has been elusive on multiple fronts. And the reason it's been elusive is because costs are, especially post-COVID, hard to contain. Number one, when it comes to better clinical outcomes, it's hard to do that when you're resource constrained from a health system perspective. And in patient satisfaction, we have access issues. And those access issues, as you said, in the opening, are going to continue. We have fewer providers servicing a growing population who needs these providers. And so where I see AI potentially coming in and being beneficial to that is on all fronts. When you look at cost, this is just one example of how AI is going to leverage. There's going to be dozens, scores of them as time goes on. As I mentioned in a prior episode, I know of some clinical groups that have been already leaned into AI in terms of creating these, basically doing the scribe work that humans used to do. That's going to continue. But at first, it's going to take some investment before it starts yielding a dividend of lower cost. But over the long haul, I think AI is going to be deflationary in general, I don't know, for in a macro sense, but I think it's going to be deflationary in healthcare over time. It's not going to happen right away, which is why I didn't make my prediction that AI is going to drive costs down in 2026. I don't think it is, but I do think that we are going to start seeing the very early beginnings of AI adoption that is going to lead to that. Access is another thing. If these patients in Utah have access to this AI tool where they can use this, answer some questions, get their refills done, they don't have to go in and see a doctor. That's one less office visit. That's an efficiency gained. Access is solved in that very narrow example, and ultimately, hopefully, if it's a good experience, the patient is ultimately happy with what happened. So that's how it connects to the triple aim. And I'm very much isolating one specific use case for AI in a very specific example, but really my prediction is AI, in the same way that Waymo and these autonomous taxis have gotten the green light from certain jurisdictions around the country, I believe that we are going to see RoboDoc, or even it's a pejorative for AI, but Dr. Clanker. Right? That's a term that's been used in a negative sense for these AI models. I think those are coming. I really do, and I think we're going to start seeing them.
I think that's interesting. I do think that there's going to be a lot of pushback on that before we get to a potential future state. And some of the material I've been reading lately is it feels like there's a divide happening amongst the country between there's a lot of pro AI in the tech communities, and there's a lot of America that will not embrace it. And so I think that'll be an interesting dynamic, especially, I mean, healthcare, as we've talked about before, is one of the most personal things that any individual and family has. And the RoboDoc thing is right in the middle, flying against, I think, what a lot of people believe in how medical care should be delivered.
I agree, but at what cost?
Yeah, totally.
So that's going to really dictate it, because if it's going to be, I can't afford $20,000 a year for health insurance, but I can afford $12,000 a year and RoboDoc, I might not like it, but I might be forced into that.
Yeah, I'm also curious just about our industry is obviously massive with so many different stakeholders, and I'm thinking about some of those stakeholders and how they may react to this. The medical community, the individual doctors, systems, pharmacists who are now getting a script written via AI that somebody could potentially make up their symptoms, make up their situation. So I don't know. It makes me very curious, and I think there will be a lot of.
Yeah.
That doesn't happen in real life too?
I'm not saying it doesn't, but it's fair enough. It's maybe a little less easy than it could be. So.
Well, the good news is there's no black market for metformin. I mean, I don't think you can turn that into
the right scripts, obviously.
Drugs.
Yes, yeah, fair enough. Yeah, it's an interesting one.
Good points. I mean, very much.
I think as a country, it's going to be a very interesting shift. And it'll be interesting because I do think that we're going to see a lot of this maybe piloted in the Medicare, Medicaid space, which, I was having a conversation with my two mother-in-laws, and they were talking about this very thing that is impacting their Medicare plans, and they had just read they're going to be basically enrolled in this pilot, and just listening to their conversation about the fear, right, and the concern about what that means, right, in terms of AI taking over the prior authorization process for certain conditions and certain care, just had me, I was just listening. But I think we're going to be faced with a lot of hard conversations, as we always are when we go through change, right? And so more to come.
Exactly.
Good topic.
It's a prediction.
It's a prediction.
That's all it is.
I think it's a great segue too, because we just talked about some prescriptions, to Jane's topic, which is GLP-1s, which are also all over the news this week.
Yes, this week. Yep. So it's sort of moved from kind of a fringe kind of benefit discussion to a really important hot topic for most large employers as they're deciding, the weighing the cost implications, the population health benefits, and then just benefit strategy and being competitive. So I feel like in 2026, there's 3 things that I'm personally watching as it relates to GLP-1s. As you mentioned, so Wegovy is now going to be available as like an oral pill starting, I think, this month. Was approved by the FDA in December. And so that's going to, cheaper to manufacture, much easier for consumers to take, which is great. But so this just leads into the 3 items that I'm looking at. So the direct to consumer pricing is really interesting. So manufacturers offering these really significant discounts for weight loss medications, and completely bypassing the traditional PBM model with rebates and discounts, and consumers taking advantage of those really nice manufacturer discounts, because it traditionally can cost anywhere from $1,000 to $1,300 a month for these GLP-1 drugs for weight loss, but you can get them for $350 a month with these manufacturer discount programs that are completely outside of the normal channel for drugs. And then I actually went to the TrumpRx.com website today to see if there was any updates, and there aren't, but that is supposed to launch in January. And so that's going to be another avenue to get these weight loss drugs that's even deeper discounted, because he's negotiated with Eli Lilly and Novo Nordisk these significant savings in exchange for no tariffs for the next 3 years. So once that website launches, it'll just be really interesting to see the traffic that comes in, uptick on that. And then finally, what I'm also looking at is the potential Medicare coverage for GLP-1 drugs starting in July. So there's a pilot program where Medicare enrollees can have access to GLP-1s if they have other comorbidities for a $50 copay. So potentially really expanding the coverage for a huge population that currently doesn't have access to it. So all of this is going to potentially drive down the unit price, but at the same time expand the total amount of people taking these drugs. So I feel like that is really going to be the conversation that's happening in 2026 is, what are employers going to do? How are they going to potentially take advantage of the direct-to-consumer costs, if at all possible? What creative strategies can we put in place to help employers with that?
And are some of those creative strategies more like HRA offerings where you're going outside of your pharmacy and just allowing people to get those deep discounts but reimbursing?
That is definitely a strategy that we're looking at, and then also trying to see predict what will the PBMs do.
Yeah.
So are they just going to tighten up their formularies, and what's going to happen with the rebates? So it'll be really interesting to see how this trickles down to
because they won't want to miss out. I mean, they're not going to want to be outside of that chain.
Exactly. Yeah. So, and I think we all know folks that are on these drugs and have had significant weight loss. They are a total game changer for people's health long term. And so, I think it's now being understood that, this obesity is a chronic condition. And these drugs are being, definitely more cultural acceptance around taking them, and understanding that this potentially can help in terms of long-term utilization and health risks, potentially save plans money if people are able to control these, obesity earlier on.
I'm curious, what do you think the conversation with employers, how is that going to change? I know, it's been a really interesting kind of sequence of events, right? And evolution of employer conversations. But I would just love to hear, what are employers saying now that is different than what they were saying 2 years ago?
Yeah. I mean, I'm really curious about this because I think right now, at least the employers I work with, it's been generally pretty easy just to simply say, we're not covering these drugs for weight loss, right? And frankly, call it a day. Cost, just how that could just really become a whole different expense and get complicated. But now, I think it's both an interesting opportunity to potentially cover something that they otherwise weren't, but also that creates another potential expense. And so I think I haven't heard anything early yet in terms of that conversation, but I do think it's going to be really, really interesting because if it's direct to consumer, employers don't have as much sort of say in how they do it, so to speak, but they have a say if they want to put in an HRA, right? But then that could open up the floodgates. So I think it'll be really interesting. Yeah. It'll be really interesting to watch. Yeah. So.
Well, you just mentioned cost. And so cost is, of course, I think number one on employers' minds right now. And so let's shift gears. Your topic is really cost strategies and what employers should be thinking about for 2026 and beyond.
Yeah, and you started the conversation with something that was spot on. And 25 years, 30 years, truly the worst renewal season I can ever remember. One of the things that I found interesting this year was that was a little bit more unique was the unwillingness of carriers to negotiate. Right, I think that's historically, and I hate to say it, it's a bit of a game, right? And we kind of have to play the game, and we're trying to figure out how to not always play the game, but usually we can get somewhere with these carriers, and they've tightened it up, and for lots of reasons, and that's trickled down into making it a really, really challenging season. So I think this isn't necessarily a prediction or a big change, but I think there's just going to be a really strong, a good amount of pressure on decision makers around benefits to be thinking much more strategically and proactively around how they're managing the budget. Understanding that they still need to retain and attract talent. They still need to offer competitive packages. But they have a budget. They've got leadership boards to answer to, and if they wait till their renewal and kind of cross their fingers and hope that's not a strategy, right? And so I think the last few episodes we've hit on some things that I think are going to become more and more commonplace and part of the discussion. And us as consultants and advisors need to be leading with this too. And not doing it at renewal time, doing it way in advance. CAP is, ICRA's, DPC. Those are the three topics we covered. But I just think it could even be that group that has been pushing off even looking at self-funding. It's been that group that is really focused on, well, we have to have every doctor in the system. I think if anything, we're going to see more and more narrower networks coming back a little bit. Kind of remember when I started, HMOs, EPOs, all that stuff were commonplace. Now it's more broad. Now I think, with all the provider contracting issues, I think there's going to be more alignment with systems, with carriers versus trying to be everything for everyone. And that's just going to put pressure on both. It's going to put pressure on HR and finance, decision makers to have to make decisions and choices. And that's really hard because, someone's going to win, someone's going to lose. You can't make everyone happy. But the big sort of thing for me is after the season we had, I don't think it's going to be, I wish I felt more hopeful. I think it's going to be a really challenging renewal season again in 2026. Some of the challenges that we've faced are not going away, and some are getting worse. And so, as Case kind of mentioned, so there's just going to, I think, be a tremendous amount of pressure on decision makers at our clients to really be challenging themselves in answering questions to other people about what are you doing to make sure we're looking under every rock and making sure we're getting creative on how we manage our pretty tight budget, because obviously we're all experiencing the inflation and the cost. So it's gonna be hard. Yeah. And I think it's easy just to try to get that renewal down as low as possible, call it a day, but I don't think that's going to work anymore. It hasn't been working, but I think it's going to only get more extreme. That's just not a strategy. So
it's interesting because in a situation like this, I think naturally we want to know who the villain is, right? Like, who is the villain and how do we get rid of the villain, right? And then that solves the problem. And in healthcare, there's not just one villain, right? There are all sorts of points in our system that need to be changed, right? But it is the collective pressure. You can look at the pressures on the healthcare delivery system, right? that are resulting in them demanding higher prices or reimbursement rates from carriers. That's resulting in these very high-profile fights, in terms of getting to agreements and threatening to be out of network and potentially moving into this new environment where we're just going to have more narrow networks, right? And then if the carriers were the only villain, the solution would be self-funding and you would be fine, right? And we all know that these pressures are on self-funded clients too. Mm-hmm. And so it really is, to your point about I wish it was going to be an immediate fix, it is the collective imperfections of this system that has been created over decades and decades and decades that's going to take a while of meaningful policy change to figure out a path forward and a better sustainable environment. And with Medicaid cuts on the horizon, right, we've got even more pressures that are going to fall onto the shoulders of commercially insured employers or employee benefit plans. And so I do think that there are still really strong strategies. We had more employers this year go into captives than ever. We had more employers ever consider ICRAs. We're having really meaningful conversation around the DPC strategies, right? And so the issue is we have to have these conversations early. I mean, I can't even believe we're talking about 2020, next year's renewal, and we're in the first business week of January. People are like, I don't want to talk about that. It's like, well, that is what we have to do in order to not repeat, right? And to learn from last year and to have really meaningful progress this year.
I kind of am loving this sort of the disruption in the healthcare market with the what I was just talking about with the direct to consumer stuff, because what we're lacking and we still haven't solved for is transparency in our healthcare world. And things that happen, I think push us more in that direction, which I'm in huge favor of, because I think that's, to your earlier point, we have such a systemic issue of healthcare costs that we cannot seem to figure out. And I think, transparency is number one.
Absolutely.
And AI will probably help with that too.
It can.
Yeah.
But your point on there's not one villain. It's a complicated thing, and anybody that's one of my greatest frustrations with the ACA back in the day is that you had a bunch of policy makers who, let's just assume their intention was good. They made decisions there without understanding how complicated it really is. By case in point, by assuming that the carriers were the main villain and we needed to cap their loss ratio, but mandate all these benefits. All you did is hand them a gift, because now they can just charge more and make more money, even though they're capped at 85% loss ratio. So those are all things that unless our policymakers understand all these nuances, there are unintended consequences, no matter how well intentioned, to their decisions. I had another point, but I got lost in my own thought there. So
it's okay. I can go.
I'll retire. Yes. Please do.
You hit on a lot of stuff that was on my mind. I'm going to make a little bit more of a bolder statement.
Let's
here.
go.
That in the next couple, maybe not 2026, but I think a large share of employers in 26 will need to decide whether they want to continue to engage or not. And what I mean by that is we are all discussing the complex system with misaligned incentives and spiraling costs. I think employers are going to have to make a decision. Do they want to continue in this environment? And if they do, because they feel it is critical to their teams to attract and retain talent and get the right employees, they are going to need to go all in. This can no longer be, one or two people amongst the leadership team operating in a silo, trying to make decisions for the good of, hundreds of employees. That's going to mean really effective surveys, engaging with your employees, figuring out what in fact do they want out of their benefits package. It's going to be board level discussions. It's going to be entire executive team discussions now about how do we address this. I wrote a paper on this last year. I mean, we all in our industry say benefits is a top 3 expense and blah, 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 blah. And it never gets managed like that in a business setting. We, as business leaders, you're looking at metrics and sales and revenues and operations and all this stuff, and benefits always gets dealt with for the majority of employers at renewal time. And everyone, does their best to try and plan for it, but last year was an eye-opening, I think, for a lot of employers who heard it was bad, and then all of a sudden at the end of the day it was, oh man, our costs are going up 20, 30, 40%. What the heck are we gonna do? So if you wanna operate in it, you gotta go all in. Starting first week of January, we gotta start talking about what are we gonna do? How do we need to modify this? Are we looking at a captive? Are we doing different things around our drug coverage? Are we looking at consortiums, associations? How can we engage with our broker and consultant effectively to map out a game plan? On the flip side, I think there will be a lot of other employers who say, we're done. We do not want to operate in this crazy environment anymore. We cannot manage an unfunded liability of 20%, 15%, 35%. You can't operate a business effectively that way. And that's the environment we're in right now. So whether that's ICRA, whether that's other stuff that happens, they'll make a decision, whether it's financially or philosophically, that they do not want to be in this space anymore. And then they've got to compete on the pros of their business. What are they doing day in and day out that actually engages their employees? Because I think a lot of people look across the table and they say, oh yeah, we're engaging our employees, and they're probably not. A lot of employers are, and we work with a lot of them, and they truly are doing that, but a lot aren't. And so if you want to attract and retain the right people and you're not going to offer good benefits, financially or otherwise, how else are you going to do that? And that'll be interesting to see how that unfolds.
I did a comp analysis for a large client recently, and their benefit, their health program, self-funded, was 15% of total wages expected in 2026. That's a big number. And to your point, it's bigger than any other fringe benefit in the mix. But to your point, two things. Number one is, yes, they haven't managed it because they can't manage it. It is uncontrollable. That is the problem. Yeah. Everything that people say you can control your healthcare costs, it's all smoke and mirrors. At the end of the day, the best you can do is maybe move it a little bit and get lucky, right? If somebody has a great year, it's luck. It's lack of large claimant luck. So, I mean, there are things that can be done, don't get me wrong, but at the end of the day, those things are overshadowed by the things that they can't control, and that's really the risk they take on. So I think your point is well taken. But going back to that 15% number, and it could be different for every employer, but if you could manage that, if you could cap it, if you could somehow,
I think I know where this is going.
if you could somehow manage that
Back
number.
to episode 1.
Yes.
Well, it's funny.
Think of where you can take even 3 points of that. Say you reduce it to 12 by going to with an ICRA and capping the benefit, defined contribution. You can then, through surveys or through other things, you can then think about other things you can bring to your employees to improve that value proposition.
I feel like when we first did however many months ago when we had our ICRA discussion, after having gone through this last renewal, I am sort of like, I am now very much thinking that is the future for us, because you're absolutely right. Employers cannot sustain this level of increase on their budget for this benefit. So I think that is definitely going to be a new, the wave of the future.
The bummer is that at the end of the day, it's still the employee bears the brunt of our messed up system. Yeah. And so, yeah, as advisors to businesses, our job is to help the business optimize, their budgets, their goals, their talent strategy, so that they can continue to grow and excel and do what they want to do in the community and revenue and what have you. But the system is not designed as it stands currently to support the members in America. And so yeah, I think there's going to be a lot of employers that go ICRA or take a hard look at it. But even with the ACA subsidies not passing, now ICRA all of a sudden is not as financially feasible as we thought a few months ago in doing that episode. So it's a dynamic landscape, and that's my prediction. You're either going to be in or you're going to be out.
Well, it is hard. It's very
Yeah.
hard to predict anything in this political environment, right? Knowing what's going to happen in the midterms, and potentially, healthcare will likely be a big issue in the next presidential election. And so I think as we just wrap this up, I think that we're in this really interesting time, and I'm really proud of the work that you all do with employers in terms of thought leadership and these proactive conversations. I think it is critical. Like, if an employer is going to think about an ICRA, start talking about it now, right? Because if you're going to do an employee survey, it takes 10 months before open enrollment, right? To really think through all the components of that. And I think for what we're doing to basically manage our current reality, the current brutal facts, right? We're doing a great job with employers. And I think employers are coming to the table with curiosity. I mean, there's no other choice, right, based on the cost reality. And I also think that, we as a firm are engaged at the national level. I'm headed to DC in 2 weeks, right? And so to try and influence policymakers in the bigger picture conversations so that they do understand the complexity of these issues at a national level. So it is hard to predict what is going to happen, I think, but at the same time, there are a lot of good things. I'm less pessimistic than you are, but I'm naturally an optimist. But I think that there are a lot of really meaningful strategies that employers can deploy in the immediate term to prepare for 2026. So thanks for being willing to talk about renewal again when literally we just finished renewals. That's hard to come back from a break and go, let's get after it. But that's what we do. That's what we do. So thanks, everybody.
The information in this video is for general informational purposes only and should not be considered legal, financial, insurance, or HR advice. Viewers should consult with a qualified attorney, insurance professional, or HR expert for guidance specific to their situation. The views expressed are those of the speakers and do not necessarily reflect those of their employers or affiliated organizations.